Welcome to Health Talk Made Simple by Aziz. In this video, we will explain dialysis fistula. We'll cover its medical necessity, surgical creation, maturation process, significant benefits, and critical daily care practices. Dialysis is a life-sustaining treatment for individuals whose kidneys can no longer filter waste products from their blood. For effective and safe dialysis, a reliable access point to the bloodstream is crucial. Today, we delve into the specifics of the dialysis fistula, a vital component for many kidney patients. A dialysis fistula is a special connection created in your arm to allow safe and effective dialysis treatments. This surgical procedure involves joining an artery directly to a vein, typically in the forearm or upper arm. This connection is a carefully constructed pathway designed to withstand repeated needle insertions required for hemodialysis. The goal is to create a robust and long-lasting access point for high blood flow rates necessary for efficient dialysis. It is considered the best and safest way to access your blood for hemodialysis. Medical professionals widely recommend fistulas due to their superior outcomes compared to other access methods. They offer a lower risk of infection, tend to last longer, and provide better quality dialysis treatments. Understanding how a fistula works and why it's preferred is key to managing kidney disease effectively. Let's first understand the role of healthy kidneys. Healthy kidneys remove waste and extra fluid from the body. These bean-shaped organs filter about 120 to 150 quarts of blood daily, producing 1 to 2 quarts of urine. They maintain a healthy balance of water, salts, and minerals, and produce hormones for blood pressure and red blood cells. When kidneys fail, harmful toxins build up in the blood. This is known as end-stage renal disease. Without intervention, the accumulation of waste products can become life-threatening, leading to fatigue, swelling, and nausea. Dialysis acts like an artificial kidney to clean the blood. It removes waste products and excess fluid. Hemodialysis, the most common type, involves diverting blood to a machine that filters it before returning it to the body. This process typically takes several hours and is performed multiple times a week. Dialysis requires strong and reliable access to your bloodstream. A significant volume of blood needs to be drawn, filtered, and returned, requiring a robust vessel. There are 3 main types of dialysis access: AV fistulas, AV grafts, and central venous catheters. Each has its own advantages and disadvantages, but the AV fistula is generally considered the gold standard. A fistula connects an artery to a vein using your own blood vessels. This creates a direct connection, and arterial pressure causes the vein to enlarge and thicken, a process known as maturation. The fistula is usually created in the forearm or upper arm. The exact location depends on the patient's anatomy. The non-dominant arm is often preferred to minimize interference with daily activities. After surgery, the vein becomes larger and stronger over time. This maturation process is crucial. It can take several weeks to several months. Increased blood flow causes the vein to dilate and thicken. This makes it strong enough to withstand repeated needle insertions and high blood flow rates. Regular exercises such as squeezing a rubber ball can help promote maturation. Once the fistula has matured, it provides a large, strong, and superficial blood vessel for safe needle placement. This ensures efficient blood flow to the dialysis machine and reduces the risk of complications. Fistulas have the lowest infection risk compared to other access types. Because a fistula uses the patient's own blood vessels, the risk of infection is significantly lower. They can last many years with proper care. A well-formed fistula can function effectively for decades. This longevity reduces the need for repeated access procedures. They provide strong blood flow for effective dialysis. This ensures efficient waste removal. Complications are less common with fistulas. They generally have fewer issues like clotting, narrowing, or infection. Patients often receive better dialysis treatments. This leads to better clearance and overall improved well-being. This reduces hospital visits and procedures. Fewer interventions mean fewer hospital admissions. It uses your own blood vessels. This minimizes the introduction of foreign materials into the body. No foreign material stays inside your body. This natural integration contributes to long-term success. Most kidney doctors recommend fistulas first. They are the preferred method of vascular access for hemodialysis. Creating it early improves success. Planning for fistula creation well in advance of needing dialysis is crucial. This allows ample time for the fistula to mature, increasing the likelihood of successful use. Now let's talk about care for your fistula. This is paramount for its longevity and your health. Check your fistula every day for changes. Regularly inspect for redness, swelling, warmth, or tenderness. You should feel a buzzing vibration. This thrill indicates good blood flow. If you don't feel the thrill, or if it changes, contact your healthcare provider immediately. Keep clean the area daily. Wash the skin over and around your fistula with soap and water. Always wash before dialysis. Thoroughly wash your fistula arm with antibacterial soap and water. Do not lift heavy objects. Avoid strenuous activities that put excessive strain on your fistula arm. Avoid pressure while sleeping. Try not to sleep on your fistula arm or rest your head on it. Do not wear tight sleeves. Avoid clothing, jewelry, or watches that are tight around your fistula arm. Never measure blood pressure on that arm. Blood pressure cuffs can damage its delicate structure. Do not allow blood tests from that arm. Avoid blood draws or intravenous lines in your fistula arm. Squeezing a ball may help. This can help strengthen the vein and promote blood flow. Understanding the creation process is also important. Fistula creation is a minor surgery. It is typically performed in an operating room, usually on an outpatient basis. It is performed under local anesthesia. The area will be numbed so you won't feel pain. There is a healing time involved. You'll need to keep the incision site clean and dry. Maturation typically takes 6 to 12 weeks. It's important to be patient. During maturation, it's normal for the vein to become visible and appear bulging. And you should feel a buzzing sensation or thrill, which is normal. However, there are warning signs to watch for. If you experience no vibration or the thrill disappears, seek medical attention. Redness around the fistula site, especially with warmth, swelling, or pain, could signal an infection. Any unexpected bleeding from the fistula site, particularly if persistent or heavy, is an emergency. In summary, the takeaway message is clear. A dialysis fistula is the best long-term access for hemodialysis. It offers superior benefits in terms of infection risk, longevity, and dialysis efficiency. It is crucial to protect your fistula. Your active participation in its care is vital. This has been Health Talk made simple by Aziz. If you like this video, please share and subscribe for more.